What is a PCL injury or a tear of the posterior cruciate ligament? How does this knee injury occur? And what traditional and current treatments exist to help you recover quickly? I'm Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I hope you feel, look, and perform your best regardless of age or injury. PCL tears of the knee are much less common than something like an ACL injury. So ACLs we hear about all the time with sports and exercise. That's a ligament in the center of your knee in front of the PCL that helps prevent your tibia from shifting out of place from under your femur. And that happens when you land awkwardly from a jump, when you run, plant your foot to change directions, and then that tibia just sorts shifts out of place with the ACL torn. The PCL is the ligament behind it, and you can't really even see it as I'm showing you there. You can kind of see it crossing the ACL. You can see it in the back of the knee very well, but it basically keeps, I'll try to show this from the side, keeps your tibia from getting shifted backwards, basically. This is a ligament that's typically torn with a direct blow to the front of your knee. Maybe you are playing sports and you land on the front of your knee with your foot in a certain position, and it drives that tibia directly posteriorly and ruptures that ligament. Now, PCL injuries are interesting. Unlike ACL injuries, which I've talked about before, which very, very, very often need surgery in active people and athletes. They don't typically heal on their own. Some PCL injuries do heal on their own. They can heal with a period of rest. And a lot of work with a physical therapist strengthening the hamstrings in the back of the thigh and in the back of the knee to stabilize the knee. That process, depending on is it a grade 1 or grade 2 or grade 3 PCL tear, and that's really a matter of how much damage there is, that increases the length of time. But even a mild PCL injury can take weeks or sometimes months to fully recover, to fully heal, and to get all the strength back enough to have the stability to play sports and exercise. Now, there's a lot of controversy with grade 3 PCL tears, which are essentially complete PCL injuries. But the trend over recent years has been more and more in athletes and active people to do surgery, a PCL reconstruction, to better improve the chances that heals. The risk you run with a grade 3 PCL is you try to rehab it, you try to let it heal without surgery, and then 3-4 months later, you're still not able to do what you want. Your knee still doesn't feel right. And then you go through the surgery, and then you're looking at another 6 to 9, maybe even 12 months to fully recover. The surgery and the recovery from that surgery, the sport-specific recovery and all of it, it's a long process, anywhere from 6 to maybe 12 months. So it's a big deal. And so if you can get it to heal without surgery, if it's a mild one, great. But if it does need surgery, you should definitely do that, but just know it's a lot of work. It's an outpatient surgery typically, but it's a lot of work and sort of patience on your part. And then again, a lot of work in rehab with a sports physical therapist. People ask sometimes about some of the newer, maybe regenerative treatments out there, and can they help with something like BPC or CJC, which are peptides. BPC has been shown, at least in animal studies, maybe to help tendons and ligaments heal, also maybe have a pain relief component. Never, as far as I'm aware, been studied for PCL injuries. Probably isn't going to do much to help the ligament heal on its own without surgery. Maybe for a mild injury, it might help, but may play a role in speeding recovery after the surgery. Same way with CJC 1295, which doesn't really affect the ligament per se, but may strengthen the muscles around the knee faster to help you get back to sports and exercise and get through the early phases of rehab a little more reliably. It's hard to necessarily know. Could a regenerative treatment like platelet-rich plasma or stem cells or exosomes speed up healing of the ligament? In theory, yes. Again, I'm not aware of any studies, animal or human, that have looked at PCL injuries and those kinds of regenerative treatments. It's one of those things that makes sense from a basic science standpoint, but it hasn't been studied. All of those treatments I just mentioned are either considered experimental by the FDA or used off-label. I've recorded whole videos on all those different treatments on other videos on my video channel, and I talk about that experimental or off-label, what that means, and what that means for you specifically. I'm not promoting those treatments. I just have a ton of people that ask me about them, so definitely check that out. But maybe they play a role in this injury. It'd be more, I would expect, in sort of the speeding the healing and speeding the recovery. May not alone be enough. Some of those injuries, like I said, very often are going to need surgery, especially when it's PCL plus other damage in your knee, ACL, meniscus tear, maybe MCL. All of those might increase the chance that you need surgery. Now, I'd love to hear about your experience with your knee injury. Leave those in the comments below. Just understand, I can't offer you medical advice anywhere online or in comments to videos, but I do try to answer those questions in future videos. Make sure to subscribe to my video channel, click the bell to be notified when I release a new video and when I start a live stream like my Ask Dr. Geier live shows. If you have an injury or maybe hip, knee, shoulder, or some other bone or joint pain and you want to get significantly better in the next 30 days without cortisone shots, without surgery, you can learn more about working with me in the description below this video. Thanks for watching. I look forward to helping you feel, look, and perform better than ever.